Hi, we're here with Jeanne Kohl-Welles, who's running for King County Council District Number 4. Would you like to go ahead with your 2-minute introduction?
Yes, thank you for having me here to interview with you tonight. And I am running for re-election. I am the fresh voice on the King County Council. I am in my first term, and I also am the most progressive voice on the King County Council. I also have the endorsement of all of the council members. But beyond being the fresh voice on the council, I also am a proven result getter. I'm a progressive voice, someone with experience to get results, and that's what I have done. I'm also a longtime Democrat and a member of the 36 LD Democrats for 30 years. I have represented this district for a long time in the legislature and now on the council. And I work very hard to be accessible and responsive and effective. I've worked with the 36, which is entirely within the 4th Council District, in fundraising and supporting the 36, in surplusing funds from my other campaigns, as well as to the Senate Democratic Caucus to get progressive members elected to the Senate. I've held fundraisers here for the 36 at my home. Other events, I have had the pleasure to have the 36 silent auction at my annual big fundraisers. I think for 15 or 16 years, I've held that with funding the fundraiser and also being allowed to support the Democrats. I pledge to continue to be the most progressive member of the King County Council, and look forward to working with you. Thank you.
Great, thank you. And you will get started?
I turn this over.
Yes, you may turn it over. And the responses will be 1 minute to these, or 2 minutes,
2
sorry.
minutes.
2 minutes to these questions.
2 minutes, okay.
What are your goals for regional transportation, and how will you work with other jurisdictions to achieve these goals?
I'm already working on goals for regional transportation. We are working very hard right now, all of our council members, on what we will present likely to the voters in 2020 to create a regional transportation district. As you likely know, the county's levy that was on the ballot in 2014, I was not there then, but it did not get approved by the voters, and fortunately the city of Seattle had a transportation district created in 2015. That expires next year, so we are working very hard with King County Metro Transit as well as the county executive to come up with the best plan. It's got to be transparent. It has to be equitable to make sure that all areas of the county are included, which I think was lacking in the 2014 levy. We need to do all we can to make sure that there's a buy-in for the whole county. In the meantime, I've been working very hard to expand transit all over the place, including in the 4th Council District, especially to make it more equitable so our service now and coming up will provide affordable, accessible transit. Our demand is increasing exponentially, and the problem is primarily the resources. How do we pay for the increased demand? And how do we make sure that low income and very low income individuals, including those who are experiencing homeless, are able to access transit?
Great, thank you. Clayton?
What are your priorities for managing the county budget? What are some steps the county can take to make its tax code more progressive and fund more of our public services?
That is the real million-dollar question. Our tax system in the state is the most regressive of all states in the country. I worked very hard for a long time sponsoring legislation, supporting, I think it was Initiative 1098 in 1998, or whatever it was, to make sure that we could have a more progressive system. We did not succeed. And And our county is very regressive as well because we are so reliant on fees and we're reliant on only being able to have a 1% cap, up to 1% cap on approving new revenue from property tax, which is itself has issues. And we have to go on the ballot for the most part. So I've been looking with a lot of my colleagues and advocates to figure out what kind of funding can we have, as well as trying to get legislation approved in the legislature to add inflation and population growth as factors in setting that limit. But I think there are some things we can do. For example, we can give an incentive for people to drive used cars that are electric or battery operated or hybrids, where they could get an advantage to waive a tax that we could place through tolling, for example, and using our transit system or expanding the roads in the rural counties, especially in East County. We need to go to the voters, but we need to make a good case. And I think certainly as a member of the budget leadership team, we have to do as much as we can to determine that everything we do across the board reflects equity and social justice.
Thank you. Jeff?
How will you address our community's affordable housing needs and provide more services for those experiencing homelessness?
As chair of the Health, Housing, and Human Services Committee, I am the lead in the council on doing that. The county serves more as a convener. We get federal funds, we get state funds, we work with others, and what we do is then issue RFPs to providers to be able to supply and provide services for low-income individuals and all of those people and families who are experiencing really very difficult times to afford their housing. So we look at housing stability, but also services for people to exit housing. I am going to be standing up a new leadership team that will work with the county and the city of Seattle, and I'm encouraging the suburban cities to have a new government, and it will likely be a PDA. And what we will do is have an inter-jurisdictional government to provide for homelessness, addressing homelessness. This is going to be a huge deal. It will go on in the fall, and we will vote for it likely in the fall. And so I'm leading the efforts on that, but we also have the Regional Affordable Housing Task Force. Councilmember Balducci was the initiator of that. I was on that task force, and in the fall, we brought out our recommendations, including creating a new subcommittee at the Growth Management Planning Council. I'm a member of that, and then we're going to be implementing the recommendations. There's so much going on, it's hard to put it all in 2 minutes, but I'm the lead for the council in doing that.
Excellent. Thank you. Mother?
How will you work to ensure access to affordable healthcare coverage for low-income Washingtonians?
So that is something, again, that comes through my committee. I also am the new chair of the King County Board of Health, so we take up issues relating to that. We know, however, that so much of that comes at the state level, through state legislation. But we can do a lot to ensure the access. And so we've been lobbying Olympia. We had a very good session in Olympia with regard to providing the path to a universal health care system, additional funding for individuals who do not have health care or have unsatisfactory levels of health care. The Cascade Care program has been passed by the legislature. So we have to be able to reach our vulnerable communities in particular. I think this is a very interactive type of goal that we have. With the Board of Health, we know, and we're standing up a new committee on domestic violence, sexual violence, gender violence, and missing and murdered Indigenous women, because so much of the need comes from people who have been victimized in many ways and need the health care, they need the support. That's an issue that I'm working on very heavily. Also with regard to climate change, and this may not seem connected, but it is. So in the Board of Health, we're creating a new effort to address climate change as perhaps one of the most significant public health challenges of our time. So that's another area that I'm working on. It's not so much affordable health care, but it's addressing the needs. We have a huge income inequality gap that is increasing in our whole country. And we're trying to pay for it all with local resources. So as much as we can, we are addressing that.
Great. Thank you. And now we are open to questions.
1 minute.
Okay, Elizabeth.
Sorry, Jeanne, you are lauded by most of the cannabis reform leadership as the
mother of cannabis.
Thank you. That was it was, and the go-to person in the Senate 30 years ago.
No, not that one. Not
How
that
many years, Jeanne? 27.
1998, I started on that, so 20
But-
years.
But it has been a long, hard time to first just make medical available and safe, then you established the ethics committee because without regulations, self-governance was necessary and maintained all of those ties. You've been through hell and high water over not just cannabis reform, but then implementation after 502. But that has now expanded into drug policy reform and harm reduction. In the past, you've been somebody that I could go to when lead funding, proper lead funding, especially for Belltown, where we gave birth to that. And other harm reduction tasks needed to be undertaken, and you have always helped us. We are going to continue to lead that. Are you able to continue to expand harm reduction and to perhaps channel some public health funding into more direct client services rather than just outreach?
Well, again, as chair of the Board of Health, I set the agenda for this year. In fact, our Board of Health meeting, and by the way, thank you, Dist. Our Board of Health meeting on Thursday at 1 o'clock, if you want to turn into KCTV, will come by. It has to do with cannabis and prevention of youth usage, but also the contaminants in cannabis, the pesticides, and the Board of Health, the liquor cannabis board is having cannabis randomly tested. It doesn't come up to what we need to do. So I'm still working on this issue. The Board of Health doesn't provide funding. We are underfunded, and we've been working to get the state legislature to provide more of the core fundamental funding for us. We did get some increase, but we can't control that. But I was known as Senator Pothead, as well as Senator Tax and Senator Jock. But yeah, I'm continuing to work on this as appropriate.
Great. Sarah? And then
What have you done in your first term, and what are your plans if reelected to expand access to transit, specifically in those areas where there are service gaps? And also, kind of, what are your proposals to kind of make transit accessible to low income and homeless individuals?
Right, and by the way, please look on here with my priorities to make sure that is included. Well, I did get in the requirement to address the expansion of transit, affordable, accessible transit use for low-income and very low. That was my doing. On the budget leadership team, we added 200,000 new bus trips a year. I just introduced legislation recently to waive the fees when there's a snow emergency network, so that's becoming part of it. We'll be taking that up. I led the efforts for the added transit for the waterfront because there's none right now. When the viaduct comes down, Shill Shoal, Sunset Hill, working with those communities. We're gonna have a pilot project started up in the fall. And I mean, just overall, I've been there all the time, not only for my district, but for the whole county, and expansion of equitable and affordable transit.
Thank you. Ben?
Got two quick questions and a slightly longer one. Can you tell me how many people are homeless in King County?
We're going to have the briefing on that. There's a 7 to 8% reduction from the year before. Last year it was 12,480, something like that.
Could you tell me
It's
roughly?
come-
Oh, I'm sorry.
Well, it looks like it's come down a little bit, but it's not a pure methodology to get at that figure, so we're gonna have the briefing on it. It's not totally true yet.
Could you tell me roughly what percentage of that population lived and or worked in King County before they became homeless?
It's a very high percentage. A lot of people think that people who are experiencing homeless now came from other areas of the country or other areas of the state. As I recall, the last figures we saw was on the order of 65 to 75% have been living in King County in the previous year.
Thank you.
Thank you. Matt?
So you've done a lot of work around homelessness. As a former direct service worker, there are lots of folks who, a huge part of the job is getting trust and building a relationship with that person. However, there's a regional issue where people aren't staying in those jobs. That's related to pay, worker conditions. Obviously, it's most nonprofits aren't unionized. And a lot of the nonprofits that do direct work with homelessness, the average wage for someone who does direct service work is under $40,000 a year. So what have you done, and is there any current work to help retain those direct service workers who usually are the first person and can make the biggest impact in bringing someone out of homelessness?
We're doing a lot, and I can't say that I have done it, but when we have the Best Starts for Kids levy be approved by the voters in 2015, and the Veteran Senior Human Services levy, which was approved by the voters a year and a half ago, I, as chair of the Health, Housing, and Human Service Committee, led the efforts on both of those for the implementation plan and the governance plan, and we made sure, and this was something I worked so hard on, was to work to have the RFPs go out to, and the programs included reaching low-income individuals, children, families, seniors, veterans, etc., but also that all the funding that would come from the county would provide well-paid jobs for the providers. Now, I don't get into the details. That's the Department of Community Human Services, but that was our mandate to them. I think that's critical. They still make way too little.
Thank you. Sarah?
How will you use your position as chair of public health and as chair of the Health, Housing, and Human Services Committee to help address the opioid and addiction crisis? And can you speak to some of your work with safe injection sites?
Sure. So I was on the Board of Health when it approved unanimously the pilot project for safe consumption sites. We were calling them community health engagement locations. And that recommendation was part of a total of 8 recommendations that came from the Seattle-King County Joint Task Force on opioid and heroin addiction. So I got to vote. I was an alternate. That was 3 years ago. I got to vote because one of our council members was absent. I visited. I took a delegation of people up to Vancouver, BC, to visit different sites and different models that they had. I've been a strong supporter and worked very hard to get this pilot project going forward. It's in the hands of Seattle right now. A nephew of mine and my brother-in-law died of overdose. And so this is a very personal as well as a professional priority of mine.
Thank you. If you'd like to take 30 seconds to wrap up.
It's not much time. Please look at my materials. This is my new doorbell piece, and I copied off of the web from my website that goes into. Please notice my background and all the recognitions that I've had, especially for progressive causes. This is my list of currently of endorsements that's being added onto all the time. Some of you are on this. I work very hard, and I want to leave you with one thing. What is so important to me is integrity and being genuine. And I will continue to include everything in what I do with integrity and sincerity and genuineness. And I do not engage in negative campaigning. Thank you very much for that.